Hi, my name is Risha Anderson. I'm a family nurse practitioner student at Eastern Kentucky University. Today I'm excited to share with you a topic that I'm passionate about, which is how exercise affects blood pressure management. The question that this discussion will answer is, in adult patients with prehypertension or hypertension, how does exercise, compared to no exercise, improve blood pressure outcomes over an 8-week period? This poster will help guide our discussion today. We'll start here in the background and significance section. Did you know that hypertension affects an astounding 33% of the world's adult population? How about that only 23% of people with hypertension have their blood pressure under control? And did you know that only 44% of hypertensive individuals have been diagnosed and are being treated? I knew that hypertension was a problem, but I did not know how severe the problem was until getting to conduct this research. Hypertension puts individuals at risk for complications such as stroke or life-threatening cardiovascular events. Hypertension has been and continues to be a cause of premature death across the globe. There are many risk factors for hypertension, including genetics, unhealthy diets, lack of physical activity, alcohol and tobacco consumption, air pollution, and being overweight or obese. Unfortunately, many of these risk factors seem to be becoming a normalized part of daily life for many individuals. Examples of these risk factors becoming the new norm, including frequent consumption of fast food and eating out rather than cooking, increased screen time over physical activity, and social drinking. Next, we'll discuss this proposed intervention and supporting evidence section. My proposed intervention that I would like to put into practice as a family nurse practitioner involves educating adults with prehypertension or hypertension regarding the benefits of exercise, developing an individualized exercise plan, and encouraging 15 or more minutes of exercise at least 3 times a week. The patient will then monitor their blood pressure over an 8-week period, at which point the patient will be seen again for a follow-up appointment and progress can be evaluated. The overall goal is to help patients improve their blood pressure readings, which in turn would put them at a decreased risk of serious life-threatening events in the future. Here in this section, you can see that 3 studies were thoughtfully selected relating this topic, and they were thoroughly appraised. Studies selected and reviewed include a meta-analysis, a randomized control trial, and a qualitative study. The findings from the meta-analysis supported that exercise consistently lowered blood pressure. The selected randomized control trial that was performed also supported that structured exercise can improve blood pressure. The qualitative study that was selected and conducted helped to identify both barriers and facilitators to exercise implementation. Here you can see that Nola Pender's health promotion model, which is her nursing theory, it can be easily applied to this problem and intervention. When applied to this topic, this theory states that patients are more likely to adopt regular exercise when they understand its benefits, feel capable of performing it, have support, and face fewer barriers. This image here does a great job showing how all of these factors can work together to help a patient feel more empowered and capable of implementing exercise into their daily life, which is the ultimate goal, with the ultimate goal being to achieve improvement in their blood pressures. Next, we'll talk about this implementation plan. To put my proposed intervention, supporting evidence, and nursing theory into practice, a detailed plan was created. The plan starts by identifying hypertensive or prehypertensive individuals, specifically of the adult population, during their routine primary care visits where blood pressure screenings are performed and lifestyle factors are assessed. The family nurse practitioner then provides education on hypertension risks, along with the benefits of regular exercise for blood pressure management. Patients collaborate with a provider to develop an individualized exercise plan, identify barriers, and utilize available support systems and community resources. Patients are encouraged to engage in at least 15 minutes of exercise 3 times a week and monitor their blood pressures at home using either a personal cuff or a loaner blood pressure cuff. Educational materials, blood pressure tracking logs, and instructions for reporting abnormal readings are provided. Follow-up occurs at 8 weeks. During this time, blood pressure outcomes will be evaluated in office and home blood pressure readings will be reviewed. The outcome being measured is whether or not blood pressure was reduced for a prehypertensive or hypertensive patient after 8 weeks of exercise, with the exercise parameters of 15-minute exercise sessions at least 3 times a week being met. Tools used to measure outcomes for this specific intervention and implementation plan would include a blood pressure cuff, a blood pressure tracking log of some kind, and that could either be a physical paper or an app, and a hypertension risk assessment tool. Looking at this here attached hypertension monitoring checklist, there are 5 questions for the patient to answer regarding their current lifestyle habits. The questions being asked are, how often do you check your blood pressure at home? Have you missed taking your blood pressure medication in the past 2 weeks? Have you experienced any of the following hypertensive symptoms in the past month? How often do you consume salty or processed foods? And how many times a week do you engage in physical activity for at least 30 minutes? By having a patient perform a checklist like this, it would help us as providers identify specific areas the patient can work on and help improve their blood pressure readings. The process of outcome measurement would go as follows, which you can see is clearly outlined here. First, we would obtain baseline blood pressure during the initial visit. And then the patient would complete that hypertensive checklist that we just reviewed. The patient would pick and implement an exercise plan of their choosing. They would monitor and record their blood pressures for 8 weeks at home. They would then come to the clinic and we would reassess blood pressure at that follow-up visit. We would review the patient's home blood pressure readings, and then we would compare the baseline and the follow-up measurements that were just obtained. Moving to this timeline, this Gantt chart on the right shows very simply what patient milestones will be reached by what week during the 8-week time period. The following activities are being measured: a baseline assessment, exercise education, exercise intervention, blood pressure monitoring, team meetings, and a follow-up evaluation. It is important that all stakeholders involved, such as the patient, provider, and other involved team members, are aware of this timeline to ensure interventions and tasks are being completed at the correct times. Here are my attached references for all of the information that was used to create this poster. I hope you learned something from this presentation that you can carry with you into your practice with your patients, whatever setting that may be, whether you're working with hypertensive patients or not. There's something valuable that can always be applied as we work to better our practice with our patients. As we help patients understand the why behind the interventions we are asking them to implement, and as we create feasible plans with our patients that will set them up for success and bring them confidence, they can make significant changes that could perhaps even save their life.